Now, let's clear something up. Functional neurological disorder, short for FND, is a real issue. It is a common thing. However, it is treatable. Yes, you heard me correctly. FND can be resolved. But so many people, even some doctors, don't really understand what's happening when it comes to your teen's FND. So today in this video, I'm going to explain it in a way that makes sense. So stay tuned. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online group coaching program to help teens with FND and their parents like you guys to resolve the condition so then they can get their life back and feel like normal again. Now, I have worked with so many teens with FND and their parents, and usually when they get the diagnosis, this is like the first time they have heard about the diagnosis of FND. So if you're new to this channel, make sure to subscribe, hit the like button, share this video with everyone around you. This will help get the word out and increase more awareness about FND, which ultimately will help you to resolve the condition because more people are aware of what's going on, right? So let's get to it. What is FND? In a super short term, functional neurological disorder, short for FND, is a communication network problem between the brain and the body. Even though your teen's brain and body are structurally and physiologically quote unquote okay. See, this is why most doctors can't find anything about what's going on inside of your child's brain and body, like EEG, MRI, CT scan, drug tests. I mean, you name it, right? Blood tests and everything else. They can't find anything. So everything comes back quote unquote normal, which is so frustrating, right? Because what you're seeing in your child is not normal, right? However, because not many people know about it, they don't get it. Maybe that includes you. Now, a little history here. Functional neurological disorder, short for FND, used to be called a conversion disorder, and which was pretty much a pure mental health diagnosis. And this is why a lot of doctors still think that FND is the same thing as conversion disorder, which is the same thing as this is stress, this is anxiety, and this is trauma. If your doctor has been basically bombarding you or insisting that your child has a trauma that you have no idea what it is, then that is usually where it's coming from. And even older version of the term is called hysteria, which is really silly, but hysteria was again under the umbrella of mental health disorder, and it was only happening for women because of this wandering womb, whatever that means. But that is how this name of FND sort of evolved into more modern term. So no, it is not just a teenager thing, or it is not just another name that includes whatever. It is a real diagnosis, and your child's not making things up, and basically your doctors don't know what it is, essentially. And what's even more confusing is if the doctors can't see what's happening in your child's body, then usually they think it's either physiological or emotional, right? So that's why they kind of conclude, well, we can't see anything, so it must be stress. Oh, it must be psychological. Oh, you go see a therapist. So this is where all of these misunderstandings and miscommunication, misdiagnosis can come into play. So sometimes teens might be diagnosed with completely different thing than FND, right? And then for years and years and years, I've heard this from so many families that they were treating the condition that they thought that was happening. However, years later, they're like, oh, actually, it was not that diagnosis. It is actually FND, which is a lot more confusing for families. However, if you have been struggling with this condition and to get the answers about FND, can I just say you're not alone? Welcome to the club you didn't sign up for, but you have found this safe and solution-oriented place where teen FND can be resolved. So don't give up your hope just yet. No matter how long your teen has had FND or the symptoms of FND, it is still not too late, okay? So it is not too late. Again, now that you know what FND is, you might be wondering, well then what is the cause? Like what is actually causing it and what is actually the trigger? Because my child didn't have any injury or concussion or anything like that. There is no obvious thing that's happening. Well, you have asked the right question, and it is a great question that everyone has. So why don't I cover that in my next video? So stay tuned, hit the subscribe button, like, and share this video. Again, you're not alone, and we are here to help you. Thank you so much for watching this video, and I will see you in the next video.